So we'll do some recalls today, guys.
Yeah.
That's a nice sign, right? Okay, the first one. Okay, guys, if you see there, I put it like original exam. I put it like time remaining. Okay, and flag for reviews. Okay, so these two options maybe you are not familiar with. In the main exam, you will have time remaining and flagging. So I'll try to, I used to be a stage performer as well. Okay, so involving your audience is always important. So I was like, so can anyone tell me by reading this question? Okay, a man is a chronic kidney disease with poor GFR, and if you see he's having dyspnea, tachycardia, and next ratios peripheral wedge shape opacity, and it's a sign called Hampton sign. I can see that as well. The next investigation they asked actually. So you have 13 seconds to answer this one. So please answer, guys. It's your time now. Okay, so time up. Okay, so let's get for the explanation. So there's two things. One is chronic kidney disease, and this question first of all looks like to me pulmonary embolism, isn't it? This is a dyspnea. Okay, and this looks like also pulmonary embolism. So dyspnea, tachycardia, chest pain, these are the clinical feature of pulmonary embolism, and also X-ray showing the same. What is the initial test of pulmonary embolism? That is, the X-ray or ECG. Some books says it has a weird finding, but it's not very common. So let's take X-ray as first line. So first line is done. So after that, they ask what is next investigation. So the next investigation you should do now what? So some will think CTPA is a gold standard. Okay, let me tell you, CTPA is called gold standard. But here they ask what is the next investigation. So next means either you need D-dimer, or either you need VQ. For renal impairment, which one is necessary? I would like to go with the VQ scan here. Okay. So my answer for this question is VQ scan. Okay. No, it's not D, doctor. Why ABG you want to go with here? It's VQ scan. It's VQ scan. See, pulmonary embolism, thrombus and these things are formed in the leg actually. As you can see, due to prolonged immobilization or a recent surgery or bedridden patient, there is chances that thrombus or initially clot that is produced. So clot is produced and later the clot is dislodged, and this dislodging clot is called emboli actually. So you will see soon there'll be an emboli. The thrombus is forming. Can you see a thrombus forming, and it will be dislodged. Yeah, see, it's gone. So now it's going into a certain point, and obstructing the lungs. And now you have the chest pain, breathlessness, all these features. Okay, so here we go. Talking about the investigation, how to crack for AMC. If they asked about the first line, always choose X-ray. If they ask about the next, your answer would be between VQ or D-dimer. If it's confirmatory, they asked, or another option they will ask like confirmatory or most appropriate. In that case, the answer would be, what do you think? CTPA. Now there's a misnomer, when VQ and when D-dimer. So let's take a kidney. So for kidney cases, started with first line X-ray, next would be VQ. and confirmatory is CTPA. But one thing to remember, when there is renal impairment, when you use this one CTPA, you have to use radio contrast dye. So using radio contrast dye in renal impairment is not a very good idea. But if they ask which one is confirmatory, always it will be CTPA. But the advising thing is not to use CTPA in that case. So VQ would be the answer, as like our case, this one. If it's a pregnant lady, okay, so in that case we go for D dimer. I just remember in this way the D like this D. No offense guys, like just for medical thing. So D for the pregnant D and D dimer. I remember initial is X-ray, that is fine. Okay, so that's how we can remember this thing. Let's get into, so first line is ECG and X-ray, next is VQ, D dimer, confirmatory is CTPA. Okay, and this sign here is called the Hampton sign. It's a peripheral wedge shape opacity. This is a punch line for AMC. X-ray showing peripheral wedge shape opacity. Either they will tell you this line, either they will give you the X-ray. Another thing that is asked in MC, very important for MC, they will give you the CT scan and you have to pick up. They will tell you, there is a long travel history, and after that a patient is having breathing problem and some chest pain, and we do a CT scan, and CT scan is looking like this. So this is pulmonary embolism. Yeah, embolus. Okay, so already these things are solved, right? So scenario given, making a diagnosis, X-ray given. So this is how they have, I have figured out 6 ways they have asked pulmonary embolism. Scenario given, make a diagnosis. So now you have to know the other differentials. So it could be pneumonia, pneumothorax, cardiac cases, So differentials you need to know. Some cases X-ray given with a short scenario, and they will ask about investigation, either first line, next, or best. Investigation, okay, like they will ask what is the most important investigation, most appropriate, that is CTP all time. Investigation choice in pregnancy, that is the D dimer. After X-ray, D dimer. Here VQ scan. Best, all time best, CTPA, that is all time best. Okay, acute case of pulmonary embolism. Now let me ask you guys, acute case of pulmonary embolism, guys, what do you want to use? Acute case of pulmonary embolism, any answers? Acute case, anyone? Yes, it's heparin. Heparin you should use, followed by the warfarin thing. Heparin followed by warfarin. In a nutshell, like long flight, recent surgery, oral contraceptive takers for a long time. So this can be some of the risks so far I have seen in AMC. There are some other risks. You should know all the risks for pulmonary embolism. Okay, so next one, better should not waste time. 21-year-old man is presented with a morning back pain over 3 months. So this is a male. Just to add you here, all the musculoskeletal diseases are mostly common in female. So you should start thinking which are the musculoskeletal diseases, those are more common in male. Okay, so young male presented with morning back pain. His pain improves as the day progresses. Okay, punchline. With exercise, physical examination showing slow posture and diminished anterior flexion of the spine. Okay, this is the, so basically when you get down, then think it's troublesome. Radiograph of the lumbar spine showing bilateral sclerotic changes in the sacroiliac area. X-ray, bamboo spine, and he undergoes physiotherapy, and he's unresponsive to paracetamol. So they asked about the treatment. You have 5 options and you need to answer. Sorry guys. Okay, nice attempt. Yep, let's go for the answer now. Yes, E correct according to, there's a book. I'm using the picture of the book so that the new people can understand. At least the motive is to help my candidates as well as the new people should understand. This is the book, the reference I have used. Master of the Board is a nice book. Those of you who are, anyone here is a medical student, 5th year or intern, must read this book. This will be life changing. No matter go for your USMLE, PLAB, AMC, this book you have to read. Okay, so this is actually the master. This is the thing. So E is the answer. Why? See, in ankylosing spondylitis, that was the diagnosis. Exercise and NSAIDs is the best initial treatment. So here's the reference. If NSAIDs are insufficient, like our case, okay, NSAIDs initially you can also use the paracetamol, so that's fine. John Murtagh also talk about the paracetamol for ankylosing spondylitis. So NSAID or the paracetamol, that could be the initial thing. So NSAIDs are insufficient, use anti-TNF drugs like infliximab and these things. Best is X-ray and accurate would be MRI. So if you go back and if you see this one, yeah, my answer for this one would be infliximab. Some books says, okay, now there's a thing, some books might tell you, I think in Medscape I have seen there are some references for sulfasalazine as well. But if you see this reference, like this one is very clearly said, they're going for the infliximab. This is a very trustable book. Okay, so I like to go with the infliximab because it was offered here. Okay, yeah, books to book might vary. I'm telling you, Medscape has a reference of sulfasalazine as well. But between a book and between a website, I took the reference always about the book. Okay, hence I'm choosing infliximab here because it's a book reference. Now there is a lot of mnemonics. I like mnemonics actually. I used to give so many example of mnemonics. I used to be medical teacher in different countries. So I was in China like for 2 years as well as a medical teacher. So I used to give so many mnemonics. So suddenly one day one student was telling, doctor, like, I think you give too many example of mnemonics. So why is it bad? No, doctor, I was thinking for your mnemonics, I have to make another mnemonic. Oh, okay. So maybe I gave too many, mnemonics to remember. So that after that, I reduced a little bit, but some of them are really nice actually, still I believe. So one of them is the 6A in case of ankylosing spondylitis, A for the, very common arthritis. Also I can add in aortitis, that's for the heart. Okay, there's antiurivitis, that's for the eye. And there's apical lung fibrosis, Achilles tendon, that's interesting. Achilles tendonitis. And age group, it's a young age group and it's a male. And X-ray is a bamboo spine, X-ray showing bamboo spine at the end. Like you can just write like this, and X-ray bamboo spine. Bamboo is a very familiar word. We call bash here in Bangladesh. It's a very familiar word here actually. You can ask some Bangladeshi what does it mean actually. So anyways, so 6A for ankylosing spondylitis. Okay, one more question done. That's okay. Next one, and this is a little controversial, guys. This question is a little controversial. Okay, so 25-year female is complaining of Raynaud's. Raynaud's, you understand, the bluish coloration of the hands suddenly in cold exposure. So that's the Raynaud's thing actually, if you're not getting what is Raynaud's. So in the cold and having edema, so some features I can see. So edema of the bilateral feet, maybe looks like heart is involved somehow. Bilateral crepitation on the lung bases and X-ray showing cardiac celerity. And the antibodies are showing ANA positive and ENA is also positive. Okay, what is your probable diagnosis? Considering this question, what do you think? Anyone wants to attempt? You have 15 seconds. Come on, guys. You have 4 options. Normally you will get 5 options. Is Dr. Rina start answering? Very good, very quick. It is quickness I like. Those are quick. They made, they finished their exam. One of my students went to exam hall and came out and called me. I got anxious. Hey, what happened? Like you call, like your exam is supposed to be, doctor, I finished so early. So now I'm anxious and I was worried. So I left the hall actually. So how come that's possible? So she said like, no, actually 1.5 hour early, like in exam. Actually, she was so good with recall. So she finished so early. So this thing happened actually. Like, so here, there's a certain thing, the same question. I just brought this question so that you can understand. So this is another version of the question. This one is another version of the question. In this question, it's a 25-year age and Raynaud's phenomenon is positive. Both primary and secondary cases. Your Raynaud's or this phenomenon thing would be present. But which one is symptomatic? Like I can see some heart failure feature and this thing. So this is probably symptomatic case. So symptoms are present. Also, the autoantibody is positive. So since these are positive, I'm thinking probably this is secondary. So because if you see this difference, focus on this, no, not this one. Focus on these differences. Primary usually less than 30, secondary more than 30. Primary usually asymptomatic, secondaries are usually symptomatic, and autoantibody is positive at the same time. A number one cause of secondary is SLA at the same time. Another common is systemic sclerosis. So SLA is 30%, systemic sclerosis is 20%, and rest is the others. So in our last question, actually, I got two positive things, antibody positive and these symptoms are positive. Maybe with age it was negative. Sometimes you have to ignore 1-2 points. So with the previous one, I like to go with C as an answer. C. Okay. And in this question, if you see, same one, 25-year Raynaud phenomenon in the code. Nothing other is given, like no heart failure feature, no other features, nothing else mentioned. Only thing, it occurring 3 years after lung infection. That was the inconvincing history, I think. ANA negative, ENA negative. So 25-year means less than 30. Panel and this thing are negative. Okay, and I didn't find any significant symptom. So this is asymptomatic. Altogether, this one's answer, it is primary. Previous one, the answer was secondary. Now you got the differences? Okay, I hope so. Yeah, secondary positive, Raju, I agreed, but we can ignore. One thing sometimes you can ignore is the ages. Some cases. Yeah. So sometimes, because not very smooth question, not always they will give you. Sometimes they like to play. Yeah. So this is one of the playable recalls, I can say. Okay. And number one cause of secondary Raynaud's, first of all, you should consider SLE. It is 70%. Systemic sclerosis is like 20 to 30% of the cases. So that's why we chose the SLE in previous one. Okay. Gout question. Okay, I like it. Chronic gout patient who is already on allopurinol. Fantastic. Okay, and allopurinol 100 milligram and intermittent colchicine. And he is having some renal impairment and urate level is in normal remit. What is the next appropriate management in this case? You have little option of 15 seconds. Come on, guys. Okay, so gout, always consider acute gout. You can consider chronic gout. You should also consider pseudo gout. Okay, all of them has been tested in AMC so far. Okay, what I'm going to choose here is D, increased dose of the allopurinol. Let me tell you why. So see, okay, for reference, John Murtagh 372, page number 372, John Murtagh. It is written in the colchicine, just you should avoid it in kidney impairment. And in master of the board, there's a line written allopurinol you can use in renal impairment. Like if the person is already on allopurinol and now some renal impairment, you can keep continuing allopurinol. That line is written in master of the board. Okay, so we'll take that one, and also we take this one from John Murtagh 372, that avoid if there is kidney impairment. So hence, and allopurinol, the dose you can increase actually. And this one I can't use because renal impairment, and I can't use. Paracetamol won't be enough. Okay. So some people say daily colchicine, but it is contraindicated in renal failure. So this one wins. Quite a clear answer. Okay. A lot of people are battling in different groups with that one. Okay. Okay, 24 years female. FSH, LH, TSH, estradiol protein, all investigations are normal. Okay, that's interesting. All investigation normal. And secondary amenorrhea, what is the cause? Now that is a very interesting thing. So any idea, everyone? Which one to choose in this case? And you have 15 seconds again to answer. I'm trying to give you the flavor of the main exam. Now, if it would have been idiopathic hypothyroidism, I think who said, Dr. Bethi, lot of doctors said like, no, if idiopathic hypothyroidism, I don't think so that's the answer, because at least some other feature probably present, even though the levels would be the same, but there would be some other feature of thyroid. And that one we don't know if the recolor has made some mistake. We don't know about the recolor's mistake. About this question, original one. The original, if it has some thyroid features and this thing, probably then you can choose idiopathic hyperthyroidism. Otherwise, idiopathic hypothalamic dysfunction. Okay, so there's a term, idiopathic hypothalamic dysfunction. In idiopathic hypothalamic dysfunction, there are secondary amenorrhea, but all the tests remain normal. So I like to go with the answer B, this one. I like to go with the answer B, this one. Idiopathic, I agree, that's a very nice differential diagnosis, but I'm expecting 1-2 more feature from thyroid. If it's a recolor's mistake, he forget to put it in the in the main question, so that could be. So in the main exam, if you find that thyroid feature, then go for the A. Otherwise, this B, I think it is fine, because B is something everything normal, but there are amenorrheic problem. So that's the hypothalamic problem. Next one,